seats right here in the front. So Dr. Patel and I both got interested in doing ozone. Some of you have been here, we'll have little brochures if you'd like to pick one up about ozone. Well, I've known about ozone therapy for quite a while. Years ago I heard about it, and I just went in one ear and kind of out the other. And then I wound up, here, have a seat, come on, there's a couple chairs right here. And then I got interested in, I read a blog about ozone for joints and that you could inject joints with ozone and that how beneficial it was. And I got interested, I thought, wow, that would be nice and interesting. So I sent Dr. Patel to a class. I went to one, I went to another one. I'm going to 2 more ozone lectures this year. And most of the people when I'm at these ozone lectures are doing stem cells. Okay, so they're not only doing ozone, they're doing stem cells. So then I thought, should we be getting interested in stem cells? And I've known about stem cells for years. Who hasn't known something about stem cells? And I had one of my patients who's sitting here has had some stem cells, and he had some good results with stem cells. And I've had other patients who didn't have such good results with stem cells. And most of the time right now what's being done is stem cells are being, a lot of the people are doing autologous stem cells. In other words, that they're doing stem cells that they get from their own body. So they get bone marrow or they get fat harvested. They get the stem cells out of that fat or that bone marrow, and then they get them injected into a joint. I felt like that wasn't something I was that interested in, obviously, and it was thousands of dollars. I've had patients pay as much as, yeah, I paid, oh yeah, no, somebody else is here, so come on in. There's a chair right back there, there's a chair over there. So I've had patients pay, quite a bit for stem cells when they do it this way autologously, and then so I was looking at maybe going in, getting, one of the lectures I was at, they were talking about these cord blood stem cells, and these are from umbilical cords that were donated from C-section, mothers that had C-sections, and they elected to donate their placenta or their cord blood for these stem cells. So that sounded interesting to me. In fact, one of the lectures, there was a fellow in Canada that was saying that he did, that he's taken them IV several times. I'm not sure we're ready for that yet, because when you take a stem cell IV, it kind of goes around to where maybe you need it. I remember at the time I had just fractured my toe, and I thought all the stem cells would probably go to my toe, and I didn't really want that. So I haven't done it. That's something in the back of our mind. That's someplace we want to go. Right now we're going to be doing mostly just joint stem cells. If we do it, we wanted to talk to you about what we've learned about stem cells and about what we plan to do as an offering to patients who might be interested. So with that, I'm going to turn over to Dr. Patel, and she's going to talk, and then I'm going to come in again at the end. So this is Dr. Patel, and I'll let her tell you a little bit about what her research has shown.
So I've got an outline because I need an outline to kind of go by and talk to you about. So Dr. Deckert also already mentioned what stem cells are. To me, in a very simplistic form, they're cells that are nothing right now. And then they become something depending on where they are in your body. So it's almost like you've got Play-Doh and you're going to be making it into whatever you want. If you put them in, if they go to the joints, they make cartilage there, they make other meniscal, if you have a meniscus injury in the knee, if they're in your tendons or ligaments, then they make that kind of tissue. If they're in your blood, they make that. So what's nice is that they're precursor cells to whatever your body needs. Where do they come from? Dr. Deckert again mentioned that they can come from yourself, so we all have stem cells in our body, in our bone marrow, and fat tissue. Got a couple of seats right there. So you can get them from your own bone marrow and your own fat tissue. And so for some people, they would feel, well, why not? Why not just get my own stem cells, and why get some umbilical cord blood cells? Well, there's a few things. One, your stem cells are as old as you are. So, do you want 50, 60, 70, 80-year-old stem cells? They're new, but there are less of them. So if we want to make the maximal effect, we want to get a good amount. Umbilical cord, that's fresh, that's new. And so that's the most powerful. The second thing is that if they're from you, we have to harvest them from you. So we have to do a bone marrow aspirate or a fat aspirate. And that requires, you know, a bigger surgical suite, that requires, it's more cost, it's more painful to you, so, so kind of pluses and minuses. So when we were looking at, you know, which way would we like to do stem cell, and very interested in doing stem cell, because this is the future, I think, of medicine. This is regenerative medicine. And ozone is part of that. It's regenerating. We're not giving it to you simply just to help your pain. We are helping with regenerating the tissue that is missing, that is causing your pain. And so we looked at whether we want to do it that way and go through the training and the expense of that, and if that makes sense, or do the umbilical cord. And it just made more sense to us to do the umbilical cord treatment. So they, you know, again, they come from healthy babies. They're screened. We'll talk a little bit about safety as we move on. Conditions that they can help. I think that there are infinite conditions that stem cells can help, but for right now we're going to be doing them in joints, because with joints we've talked to several doctors who've been doing them and done enough research to know that they work well for joints. I think they would work for other things like muscle injuries, ligament injuries, even like systemic issues. But the problem with giving it outside a joint is that you don't know where they're going to go. You can give, you know, like I can give you money and say go buy food, and you could go and buy, you know, shoes. So that doesn't, it's like you don't know where that's going to go. So right now, until we figure out how to get it where it needs to go and be effective, we're not doing that, and we need to do more research and learn more about that. So the conditions that it can help, it'll help any place that you've got arthritic changes, any degenerative changes. You're going to see You're going to see an effect there. If you've got cartilage deficiency, even meniscal issues in the knees, you're going to see a change there. How much do you need? Most of the time, it's 1 cc, about that much. Okay, very little amount, concentrated. There's usually about 10 million cells in there, and then as soon as you put it in, it propagates at least for 65 generations or something. The umbilical cord regenerates really quickly. So at the end of it, whatever joint we're putting it in is already seeing 500 million cells to regenerate the cartilage there. And you don't generally need more than 1 shot. So it's not like with your steroids. I mean, and steroids are not healing. They're just helping you with pain. So if you've ever had knee pain and you've come in for a cortisone injection, it's great, but it wears away. It also has potential to weaken the joint. So, you know, that was all we had before we had ozone, and ozone's been wonderful. I've seen great results with ozone, and for that I can even do musculoskeletal pain, and we've been doing a lot of different things with ozone. But with stem cells, again, it's just a one-time shot. Okay, rarely do you need to. I think it's, I mean, I can't, everybody I've spoken to who's done them has only said 1. How long before you start feeling a difference? This varies per person. It can be a week, it can be a few months. Because what's happening is there's healing going on. So when you get the injection, you are not going to walk out of here like you do when you do get a steroid or an ozone and feel like, yay, I feel great, I feel wonderful. Because what we are doing and what we want to do is we want to create inflammation in that joint to an extent. Because inflammation is good and bad, but it's good when you want to heal. And then you need it to stop. And so initially the stem cells need a little bit of that inflammation to get things healing. And so some people will see a difference sooner than later, but they all see a difference. In talking to some patients who I've known who've had it done, they felt like the first week or 2 they were a little bit more sore than they were even before they came in for the injection. Then they were about the same baseline they were before they even had the injection. So now they're thinking, okay, I've gone a month into it and I'm feeling no different. And then it was after that that they continually got improvement. So, I mean, that's one, but I mean, you can talk to different patients and everybody can have a wide spectrum of how quickly they heal. Do you need more than 1 shot? Really, no. It's very rare that you would need 1 shot. I haven't heard of anybody getting a shot. I mean, obviously, there's no guarantee, so I mean, nothing in medicine is really guaranteed. So it's a successful shot. It's probably 90+% effective, but I just couldn't guarantee it would work. Then then getting down to the risks. This is not an FDA-approved procedure, okay? Having said that, the cells that we get, cells that we obtain, we are getting them from Utah Cord Bank. We checked out several different companies that we wanted to get them from, and we just kind of compared several different things, how many cells they have, where they get the product, how stringent they are about preserving it, how they preserve it, and we went with this company. But their cells, their storage, how they process everything is FDA approved. But the procedure of us giving you stem cells to help you with pain and help you regenerate, like that part is not FDA approved. So I just want everybody to know that. The risks of the procedure, kind of going back to, oh,
Hi.
there's a seat right there for you. Right for you. The kind of going back to whether we take it from you or another source. The concern I had, or I mean I think anybody would have, is if we take it from another source, is our body going to accept it or are we going to reject it? Okay, that's the first thing. Because we can't give blood to just anybody. We can't give an organ just to anybody. We have to go through all these checks. Well, the nice thing about umbilical cord is that they're not differentiated. I mean, these cells haven't really got markers, and they haven't figured out that they're all Dr. Patel cells, right now. They're everybody's cells. So, so I can give them to anybody and they would still work. Whereas as you get older, or as you start differentiating and you start aging, those cells cannot be used for everybody unless you specifically match them. So the risk of having any kind of donor reaction is not a very viable risk. Safety from communicable diseases. These stem cells are checked for several common diseases like HIV, HLV, and I have a list of all of them, and when we do this process, we'll go through a more informed consent and go through every little detail about risks and benefits. But they have been screened thoroughly for these, for those concerns. Any questions about any of this?
Well, you say that one shot is all that you need. That's per site.
Yes.
So if you have pain here, there, and wherever,
Yes.
that's one shot per site, right?
Per site, yes. Because if it's your shoulder, I'm going to put it into this shoulder. That's not going to really help this knee. Yes.
On that same vein, can you get another shot in the same location?
You can. You probably want to wait and give it about 6 months because, again, sometimes, like I said, the effect doesn't happen immediately. So I wouldn't want you to go through the whole process, have to pay for it, and then not have the benefit. So I'd probably have you wait. You can, but again, I'm not sure if many of you know Dr. Krieg. She used to work here before, and she's been doing them up in Northern California and having good success with them. I've talked to a doctor who's been really kind of helping us, with a lot of different things, and he's been doing it for about 1.5 years and hasn't had to give anybody a second shot. Now,
How is the success measured? Is it subjective or objective? Do you take like an MRI before and after and see how much cartilage is grown?
so
Is it measurable?
it's measurable. I mean, I think subjectively it's measurable. You're fine, you're not in pain. But we do, before you get the injection, ask that you get an x-ray done of whatever joint that you want injected. And that you can, I mean, we haven't obviously done them, so I can't say that we did your x-ray today, 1 year later we checked and you had growth. But I would love to do something of that sort and see. And I'd have to find out if they've done that. But I think most of them are doing subjective findings and finding that people are doing okay. Yeah.
And you just do 1 cc at a time? Or can you do more than?
You can do more. I mean, the cost goes up because we pay per cc, but you generally don't need more than 1. So you could do 2, but the thing is, I mean, why pay more for something that's not going to make a bet and not going to help you? Yeah.
She means one here and one there
Yeah.
at the same time.
Oh yeah.
Or-
Okay.
Multiple locations.
You could get multiple locations,
No.
but keep in mind, if you're a person who has swelling and pain, a little bit more inflamed after I give you the injection, I'd like not to do both your knees at the same time.
Yeah, I'm thinking that you know,
Yeah.
I think anybody, obviously there's a cost about this, that's what, you know, we're here to talk about, and we're gonna get into that. So I think doing the worst joint to start with, you know, or doing a joint, one joint before someone invests into 2 joints would probably be a good idea. I mean, you know, obviously one of the reasons you know, we're basing this on the experience of a lot of people that we've talked to, but joint injections are certainly nothing new for us. We do a lot of joint injections. On it. There's also one back here, if you wanna come back here. So anyway, so you know, Dr. Krieg is my cousin, and she called me and she said, you know, Pat, you need to be doing this. This is amazing what we're seeing here, and that people up there are, you know, that it's really simple. We got into, you know, I guess ozone really made us much more comfortable with doing joint injections, especially knee injections. But with ozone, we're able to do trigger points and a lot of other things that we wouldn't be doing yet with stem cells. I think stem cells right now are just on the cusp of people, where are we gonna be going with these? I mean, what's gonna happen in the future? I guess my biggest concern is that something comes along and the FDA says we can't do these anymore. I mean, that's, you know, that we all known of things like that, or that there's more regulation about it. Right now, there's a lot of people doing stem cells, and there's, you know, so all that has to happen is one person have something bad happen, and then the next thing you know, the whole thing gets kind of shut down. So we kind of wanted to jump on the bandwagon before it got too regulated. So that's how we got kind of interested in doing this. Yes, Jim?
You mentioned in the ozone, is that something that's planned, the 2 together?
No.
No.
So, no, ozone, I got some brochures out on ozone for you to pick up, because I'm picking up, talking about ozone quite a bit. When we got interested in doing joint injections with ozone, we you know, just got experience in doing it with ozone. We think that ozone is stimulating stem cell response in your own body in that joint, but there's no real proof that it's doing that. We know that if you go online, and there's a Robert Rowen, R-O-W-E-N, has got YouTube videos up the wazoo about success he's had with ozone injections. And I met Robert Rowen at one of the conferences I was at, and Dr. Schallenberger has got lots of YouTube videos. Schallenberger's kind of the father of ozone treatments. She went off and took a Schallenberger course. I went to the one where Rowen was at. I plan to go to Schallenberger's too, so that we can all learn. The advantage of ozone is that it's not as expensive as stem cells, okay? So we don't have to invest in us buying these stem cells, getting them here, freezing them, the cryo involved. So stem cells are gonna be more expensive. But what we've seen with ozone is that, one, you have to sometimes repeat it. It's different than cortisone. Cortisone reduces inflammation, but has some negative side effects, and that cortisone eventually is going to wear out that tissue. When you take a non-steroidal anti-inflammatory drug like Motrin or Advil, you're destroying some good prostaglandins and bad prostaglandins. So the joint degeneration is going to accelerate.
And even though it's not FDA approved here, a lot of places in the world are doing it. I mean, I know that we don't only look out and we think that the US has to be the one that really does it well, but many athletes have gone to Germany to get
Mexico,
this done.
we're going to Mexico.
Panama has one of the
They do it
leading
in the Cayman
experts
Islands as well.
experts on stem cell therapy. So it's like these researchers are great. I mean, they do well. They don't have the regulations we have. And I mean, having said that, I mean, it's not like one way or the other with FDA, but I mean, I've seen many FDA-approved drugs cause problems for people. So it's sort of how you take it. But the research is there. It's just not in the U.S. and the FDA has all its regulations. But if you go worldwide, like I said, many athletes have been using stem cells for quite some time. So there is a little bit of longevity, reports on that.
2 quick questions. One, how painful is it, and what negative side effects have been reported?
So the joint, the injection's probably not going to be very painful, and like I said, we've been doing joint injections for a long time. It's just that the content of what we're putting in is different. But, so the actual injection, I don't think is gonna be much, I think in certain small joints, oh.
I always say that the only time joint injections hurt is when we miss. If I didn't get into that joint, then that hurts. And I think little joints is a little harder than it is into a nice big joint in a shoulder to get into. When I get right into that shoulder or right into that knee, most people don't complain at all. It's when I hit a tendon or a ligament or a nerve and then it, and I've had, then I go, oh, I'm not in the right spot, I need to move spots a little bit. So that, okay, the second question was?
Yeah, and
the
then,
side effect,
and the after effect, of course, remember, we're trying to stimulate healing there, and healing requires inflammation. So what will happen is that joint could hurt and get inflamed after that because your body is sending resources there to fix it. So how much pain you have, it's hard to say because everybody has a different pain tolerance and how they heal. There are some things, and we go through it for aftercare, you can't take anti-inflammatories, okay? You can't ice the joint because we are then doing everything against what we were trying to do. So you can take Tylenol for pain if you want, but you just can't take any like aspirin, ibuprofen, Aleve products, no steroids, you can't put ice on it, things like that. So it's hard to say how painful, I mean, the process itself, yeah, like smaller joints hurt because there's not enough space and we're putting liquid in there. Larger joints don't hurt as much. But then your effect after that, it may be that for a week or two, you might be hurting a little bit more than you did when you first came in.
Any systemic fever from it? Does it go that far?
No, it's localized to the joint.
From what we're hearing.
Yeah,
Obviously, we
we're not-
haven't done it yet, but we, and we're not ordering it until we see we get interest. I mean, we're not gonna spend thousands and thousands of dollars to order stem cells. We did order the tank to freeze them in, so we've gone that far. That was only $200 to order the tank to put the stem cells into so that we can store some stem cells here. But we're not ordering until we see people are interested. We're not gonna push or pressure anybody to do anything they don't wanna do. Go ahead.
No, I was just had another question, in kind of a different vein, two-part question.
Mm-hmm.
One, does it affect my DNA? Second part, if it does, since I don't plan to father any more children, does it make any difference anyway?
No,
it
it doesn't.
Not that we've seen anything to say that it affects your DNA. Now, I looked at a lot of studies on it, and I haven't seen anything where it's affecting your DNA. So I don't think it does.
Yeah, I haven't, in any of my research in it, I haven't come across that either.
Mhm.
So, those anti-inflammatories, I understand, what if a person was on numerous medications for autoimmune disease?
Yeah, I don't know whether stem cells would be indicated there because those DMARDs, those drugs that people use to suppress autoimmune diseases, would probably suppress the stem cells from doing what they need to do. So it probably wouldn't be an investment someone might want to make into doing stem cells if you're on those drugs.
Are you guys going to accompany the stem cell therapy with prolotherapy and plasma?
We're not, but some people do. Yeah, we aren't doing that, but there
Just
are
doing
people.
the stem cell?
Yeah, we're just gonna be doing stem cells and whatever the things that would support those stem cells, but not prolo, not with platelets. Some people do platelets with autologous stem cells, yeah. So they do that with that.
I think Prolo would be really good with muscle injury and more my back sore and then doing a whole Prolo and doing the stem cells with that would work. You don't seem to need it as much with the knees because when we've done at least the conference I had gone to, they were doing a lot of ozone with PRP and finding that it helped. But from the research I've been doing with stem cells is that you don't always need that. I know that there are some doctors who do the Prolo or the PRP or all three because, basically all we're trying to do is irritate that joint. Prolo is simply just putting sugar solution in. So it's always a thought, like I'm going to irritate it, now I'm going to give it something to fix it, so it should kind of have more of an effect. But, we're just, I think part of it is that we are new in doing it, so we want to make sure that, see how that is. And
Are you guys going to get any sort of, I know there's a lot of companies out there who, like Regenix, for example, they have their own protocol and they certify their own people. Are you guys going to get any sort of certification from anyone? similar to that?
We looked into trying to find someplace for certification. We talked to several different companies and nobody was offering any real certification in stem
Okay.
cells.
I know Regenix does.
Well,
Do they do autologous? Because I don't know if they do umbilical cord. Like, we were looking at more,
They primarily use your own at this point, but,
yeah. I've seen trainings for those because,
The
and there's
harvesting,
quite a few of
yeah.
them, like how to harvest it, how to redo those, and then there are training courses for that, but that's if you're taking your own. Since we're not doing that, there weren't any trainings available for that. So what we're going with is talking to as many doctors who are using cord blood and saying, okay, well, what are your protocols? What are you doing? I mean, there was, when I was talking to the rep for this, I mean, he's like, oh, you could put 2 cc's or 4 cc's into a joint, you know, and it's like, okay, that's great, but that's like another 1,000, 2,000, you know, that's, I mean, that adds up. But then when you talk to doctors who are in practice, they're like, 1 cc does the job. So then why would I need to do more? So I think right now we're doing that, and I haven't come across, I've asked a lot of these companies that we've looked at, training courses, because we would definitely take them or, you know, want to be a part of them, but none of them do. But for the ones where you're harvesting your own, there are training courses available.
Okay.
back to the question on the FDA and all that, you know, the medical community as a whole in this country has been very reluctant to change. I mean, they're really pretty narrow-minded. It's been interesting to watch over the last 5 or 10 years that the ortho community has bought into platelets,
Well, I think that,
PRP.
excuse me, I think that's because we've always done it this way.
Yeah, right.
I mean, that's the heading.
Right, and the way medical school is trained. I mean, obviously, how you're trained is in pharmacology. Who's really paying for most of the education of medical students is the pharmaceutical industry. So we've been really, the whole medical industry, when they say evidence-based medicine, well, what's the evidence on? The evidence is on what drug works for what problem. So, you know, for those of us who have kind of swum against the stream here and gone into more alternative things and have an integrative practice, we do a lot of things that are outside the box, and we've had to be a little more open-minded. But we also want to be careful. I mean, when I went, I think that we've been, I'm cautious about, I haven't just jumped into anything that I thought would, in the first place, do no harm, but I also have been cautious on what we've incorporated into this practice, so.